About 200 years ago, only 50% of kids made it to their fifth birthday.
Today, we sit down with a researcher and pediatrician, Dr. Yoshi Rothman.
About 1 in 10 kids in the United States is diagnosed with ADHD. That is a huge number. That's 7 million kids in the United States. If we were prescribing medication for all 7 million kids, that would be a huge deal.
In this conversation, we talk about your children's mental health and what you should really know.
The levels for depression went up 50 to 60%, and the level of anxiety went up 30 to 35%. These are alarming statistics, and what can we do? It's an interesting time to be a pediatrician. It's an interesting time to be in medicine, and I'm going to spend my career trying to help these patients and these families. And I hope that when we have this same conversation in 30 or 40 years, that we've made a dent in those conditions.
So before we dive into this amazing conversation, we do want to let you know that we are going to be making these conversations CME approved. So that means that if you're a physician, physician's assistant, a nurse, social worker, you can actually get credit by listening to this conversation towards your professional license. Our goal here is really to tackle the challenging questions that we face in healthcare, but more importantly, find some solutions. So we appreciate your support, and let's dive into it. Dr. Yoshi, tell me, are we overprescribing kids with ADHD? Are we giving them too much medication?
That's a great question. So, ADHD can be a truly debilitating disease for kids. So, if you're diagnosed with ADHD and you require medication, that means, in my mind, that you've gone through all the different channels of behavioral interventions. And so what that means is, you can set up your school environment to optimize your ability to, for example, stay focused in class, or you can have aides at school. You can set up your home environment to make sure that kids are staying on task, things like that. If you've failed those, or it's so severe that you require medication, that's when we should be prescribing medication. But one great mentor of mine once told me that there's so many other conditions that might look like ADHD that we need to make sure that we rule out. So, as an example, you cannot diagnose ADHD without talking about sleep. So, if you have a child who is not sleeping well, or let's say they have a sleep condition like sleep apnea, that could be looking exactly like ADHD. You could have the inattention, you can have the hyperactivity, the impulsivity, those classic signs of ADHD, just because a kid is not having regular good nights of sleep. So I want to make sure that people remember that we need to rule a lot of things out before diagnosing ADHD. Now, are we overdiagnosing ADHD? There are a lot of kids who probably could be managed, or at least we could do things or make changes in their life that would remove that diagnosis. So I'll give another example. Kids who are on screens excessively. Some kids might be predisposed to develop ADHD like symptoms. So if you remove those screens, those symptoms will completely go away, right? So that would not be ADHD, but if you didn't take the screen away, you might be quick to diagnose ADHD in that situation. Now, you may know this, but about 1 in 10 kids in the United States is diagnosed with ADHD. That is a huge number. That's 7 million kids in the United States. So that has a huge impact on how our society functions, how schools work. And, if we were prescribing medication for all 7 million kids, that would be a huge deal. So I want to make sure that we keep that in mind. And also, the last thing that I'll say is, Some kids that we diagnose with ADHD are probably just kids that weren't meant to be in a classroom focusing on a screen for 8 hours a day. Maybe if there were alternative options for kids that were more, I'd say, disposed to working with their hands, for example, maybe they wouldn't be diagnosed with ADHD. So just some food for thought.
That that's crazy. So 1 out of 10 kids are diagnosed with that's I didn't realize it's that prevalent. And is it have we seen over the years, like, have there been any, like, longitudinal studies that kinda show that there's been an increase in the diagnostics of ADHD? And how much of that is because maybe we've gotten better at diagnosing it or to, like you said, the intrinsic factors like the screen time?
So we've definitely had an increasing number of kids diagnosed with ADHD, but it's really hard to separate. Is this that we are more aware of the diagnosis, or is this screens? Because as you might imagine, those things kind of happened around the same time. Um, I think the bigger uh, or a stronger way to make that case would be to remove screens from kids and see how many fewer kids would qualify for the diagnosis of ADHD. And I think that would be it'd be a hard study to do, but I think it would be such a meaningful study. So for all those academic researchers out there, I think that study needs to be done.
For sure. And I think for the parents out there too, you're not saying like, "Oh, remove the screen and you're gonna see it go away right away." Like, what this is probably gonna take weeks to months to actually see some results. What do you think?
I think that probably if you remove the screens within a few weeks, you would notice significant differences if your kid is one of those kids who is predisposed to screens getting them off track or kind of mimicking ADHD symptoms. Not every kid with ADHD like symptoms who you remove the screen is going to have a positive response. But I think one other thing to keep in mind is that sometimes the kids who may be having more screens are kids who already have ADHD like symptoms and the parents are trying to manage those symptoms. So in some ways it's, what came first, right? Is it the behaviors and then the screens are given, or were the screens given that led to the behaviors? So the only real way to know is to remove those screens as much as possible. And I would tell a parent, if after 1 to 2 weeks you're not noticing much of a difference, then I'd say we need to evaluate that child more extensively.
So what do you say to the parent that is, they're working their full-time job, they've got multiple kids, and they just don't have the time to be like, "Oh, I need to go set up an IEP for them. I need to get all this stuff set up that you recommended," which makes sense, but they feel like, where do they find the time in the day to do that? Whereas, like, you could just give them medication where that might get them on track, and we're out to eat. The kid wants to we need to distract him. Here, take the iPad, which how often do we see that as well? It's like, what do you tell to these kind of parents? These are very real problems that they're facing.
That that's a very fair question, and it's one that comes up all the time. This is not easy. In order for kids to function in the society that we've created, it requires a lot of attention. In order to be in classrooms, kids need to be able to stay focused for an hour straight at a time, for a lot of kids. And if the home environment is such that anytime, somebody gets fussy or somebody is not wanting to follow directions, we give them a screen, then that's going to create a difficult cycle to break. That said, I think in very particular instances where you need your child to stay focused or to not do something dangerous. So like here's a good example. Let's say your child falls and hits their chin and has a huge gash on their chin and it needs to be, stitched shut. That's a perfect example of a situation where maybe you need to keep your kid focused and away from, this medical procedure that's happening. But how do we encourage families to keep the screens away in circumstances like when you're out to eat. What types of things, what are other things we can do? Can we get out the crayons and, paper, and can we draw together? Can we as a family play group games at the table? What are other ways that we can engage with one another that can foster connection and growth and social interactions that don't rely on the screens? And again, it's not easy, but hopefully putting in that effort on a consistent basis will pay off in the long run.
And then I think that that effort in the long run, then also you're avoiding because a lot of them are going to say, here, just take the medication, or the parent just wants the medication, right? But if you can steer them down a different path, I imagine that that's going to actually help them build a skill set that's going to help them for many, many years to come that maybe they weren't given the opportunity if or was prescribed too early.
Yeah, absolutely. And not just that. I mean, I would say just because we prescribe a medication right now doesn't mean that your child's going to be on this medication for life. So I want families to know that this is going to be a work in progress, and we're going to make adjustments as we go. And some kids who we don't try a medication, maybe later on they might need one, or we start one and then we see such improvement that we decide to try lowering the dose or even stopping it for a brief time, and kind of seeing how things go. So I hope that parents will be optimistic that there are options, and this is something that should be always an ongoing conversation with your pediatrician and your other healthcare providers.
I love it. I love it. Okay, I want to move on to some more good stuff here. Um, Tell me, what do you tell a parent that comes in that refuses a vaccine? How do you handle that situation?
That's a good question. So I'm going to make a quick disclaimer because this does come up all the time. So, number one, I am an employee of a university. So that means I'm salaried and I do not get payments from pharmaceutical companies or insurance companies. And then number two is that I have been offered incentives to give vaccines through my university, but I have personally decided to opt out of that financial incentive. And the main reason for all this is I want to make sure that parents feel that I don't have a hidden agenda. So I wanted to just make that disclaimer up front. Now,
Love that.
back to your question. So, how do I handle un- unvaccinated kids or families who don't want to vaccinate? So, I want parents to know that I'm a consultant for them. Okay. I'm here to make recommendations. I feel that the benefits of vaccines outweigh the risks in most cases. But that said, nobody should feel pressured to get a vaccine, and no one should feel that they need to get a vaccine. Otherwise, they're going to be kicked out of their pediatric practice. And it's it's interesting because there are so many families who feel that way or have actually been kicked out of their practice. And I personally don't agree with that approach. And actually, in the New England Journal of Medicine, a article came out just a few weeks ago, and it talked about the case for accepting an unvaccinated child into your practice versus refusing that patient into your practice. And as you might imagine, on the one hand, you want to make sure that every child is taken care of. But then on the other hand, you want to make sure that you're not potentially exposing other kids in your practice to, say, measles, for example. And if there was a poll at the end of the article where pediatricians could answer, would you accept the patient or would you not accept the patient? And if you had to guess, what percentage do you think uh, would not accept the patient into their practice?
What percentage would not accept the patient who doesn't have a vaccine?
Correct.
I would say 20%.
So it was 42%.
Wow, okay.
So that means that almost half of pediatricians, at least who read that article, would not allow an unvaccinated patient into their practice. And I don't do that, but I do know of practices that do. And you can imagine how the distrust builds in these situations. I think we need to change the narrative here. I feel like we need to talk about this so that families see that this is important to us. To specifically answer your question in my personal practice, so I will give parents the recommendation, and if they choose not to vaccinate, then that's their decision. But it'll be an ongoing conversation. And if they want to change their mind, that's fine. If they don't, that's fine.
Wow. There's so much I want to uncover here. I mean, the first, I want to come back to is I think it's incredible that you're being so transparent with it and that you've decided to forego maybe that monetary advantage for giving a vaccine. Um, but the truth is that you are not probably in the majority that does that, right? And there are a lot of doctors out there that do say, okay, this is another opportunity to make a little bit more money. You know, how do I even tell a parent that knows that we have a system that works that incentivizes doctors to maybe offer a certain medication or a vaccine in order for their financial gain?
It's a really complicated situation. So I think if you think of health insurance, pharmaceutical companies, incentives in general, these companies want to save money, right? I mean, you see it in the news, you see it on social media all the time, all these denied claims, right? People don't get their bills covered, they don't want to pay for things. Now, if you're an insurance company and you can prevent outbreaks of certain diseases, like for example, there's a outbreak right now in West Texas of measles. I don't know if you know that.
Yeah.
And it's in mostly unvaccinated kids. At least the numbers as of Friday were saying that 7 out of 10 kids were hospitalized. What is the cost to an insurance company of a hospitalization for measles versus vaccinating the entire community for measles every year, year in and year out? And I'm obviously not the financial person, but I wouldn't be surprised if they've done the financial modeling and they've said, all it would take is this number of hospitalizations that would then cost us way more money than just giving the vaccine every year. I don't, Insurance companies don't care about our health. They just want to save money, right? Pediatricians, hopefully, do actually want to take care of your child and want them to be healthy, right? I, So I guess I just wanted to address that sort of financial piece of the question. Now, how do you talk about this with your pediatrician, or how do you feel comfortable knowing that these incentives are happening? And I think the truth is that this financial incentive should be taken away. I think that pediatricians should be incentivized to take the best care of their patients, so addressing things like obesity, mental health, you know, development, screening for things like tobacco, HIV or STDs, things like that. But because of the politicization of vaccines and the vaccine environment and hesitancy, I think it would be good faith for pediatricians to take this incentive away and really focus on other areas that we could incentivize pediatricians. Because look, I think good pediatricians should be incentivized for delivering good care. And I would hope that patients would feel the same way. But this is not the way.
I think this is actually an interesting outlook at it because insurance companies save money when they keep people out of hospitals, right? Their job is to, and some people might say, or if you're in the insurance company, they say, yeah, our job is to keep people healthy and keep them out of the hospital. And they absolutely have run a stress risk stratification assessment and said, okay, if we pay to get these vaccines out here, we are going to have to pay less money down the road. But that also means healthier kids, right? And so that's where there could be some advantage to this, right? Um, I think and that's where we talk about the preventative side of insurance, where it actually could be really beneficial if they start understanding if they invest more in the preventative side. But I think the challenge with our current healthcare models, it's so reactive and so treatment based that majority of their money is going towards the treatment base, and that's why we're seeing a lot of the rejections when we were getting that care.
I think you're hitting the nail on the head. I think that despite the fact that giving vaccines could prevent hospitalization and could be ultimately beneficial for society, I think because of our climate of vaccine hesitancy in the United States and honestly globally, I think at least for now, taking that incentive away would at least restore some faith in patients and families. Or at the very least, this should be an open conversation with your pediatrician, and you should be aware if your pediatrician is getting incentives for vaccinating. I think that would be a fair bit of transparency.
Yeah, I think transparency is the absolute key to build the trust back, for sure. Do you know if by chance, and I know we're going off script here, but do you know if your hospital offers like a pricing sheet or something where someone can understand like kind of the prices that they're going to be charged going into it, or not sure?
So this is also a very complex conversation that you're uncovering here, which is that based on your insurance, or if you don't have insurance, the costs of things is different. Now, if you're paying out of pocket for vaccines, there is a very clear dollar amount for those vaccines. But your insurance is going to negotiate different prices for those same exact vaccines. And insurance covers vaccines. So you shouldn't be paying for those vaccines if you're insured. But what you would see if you asked for a bill is that the cost would be different based on the vaccine. So, and that's true of pretty much all medical care in the United States, at least, that these negotiations happen behind closed doors, and you don't really know how much you're paying or how much your insurance is paying or what they're paying for unless you ask for like an itemized bill, which most aren't doing that. And in other countries where they have more of a kind of centralized form of medicine, they do disclose those numbers, but also oftentimes those are covered by the either national health insurance or the private health insurance that is part of a national system. So, to answer your question, it is very unclear to patients what's being charged, how much is being paid, and even if they get a bill, what they're getting billed for, how much of it is, let's say a vaccine or, part of the visit. And I wish that was transparent too, but even sometimes doctors, as you're probably aware, don't know how much something is going to cost the patient. And that creates a real challenge because, in certain situations, I might not necessarily feel like this test is worth this cost to this family. But on the other hand, I shouldn't make decisions, clinical decisions based on the cost. I should do what's best for that patient. But if you're somebody who has gone through an extreme amount of medical debt, you might say, well, I wouldn't have done that if I would have known that this was going to take, my family or put my family into medical debt. So that's a whole nother can of worms, but it is a reality, unfortunately.
Have you had any patients or parents that you've seen personally struggle from something like this?
So I haven't seen a family who has been put into debilitating medical debt from a visit with me, but I definitely have had families reach out and say that they were billed for something that they didn't expect, or they were fighting with insurance over a specific claim. And it's really unfortunate because these are families that have one or more kids. They are already busy. They're, trying to make ends meet. And then they also have to deal with these insurance claims. And I just, I wish that we were in a system where this would just be covered internally and not trickle down to families to deal with.
For sure, for sure. It leads to so much anxiety and depression on so many levels, and that's something I actually wanna kinda shift into now is that, personally, I'm kinda worried for the kids of today in the world that they're being brought up in, just with social media and all the kind of external triggers that they have on them. How do you help guide parents in this? And if you start seeing some certain red flags that may indicate that you need to refer them to potentially a therapist or things like that?
Yeah. So parents sometimes will bring their kids in for like a mental health concern, like you're alluding to. But most often, what happens is kids will come in for their annual well visit, and we pick up on a mental health condition in that well visit. So we will screen kids for depression and anxiety when they come in for those visits. And sometimes it's more mild, and it's something where even just having a conversation in the office can be illuminating and can help us identify ways that we can address this, you know, at home and with the family support. But there are also times where a kid is comes in and is expressing self-harm or is expressing suicidal ideation. And these are sometimes cases where we have to send a kid to the emergency room from our clinic because we might worry that if we don't, they could go home and harm themselves. So there's a huge spectrum, and at least looking at the data from pre-pandemic levels to now, as you might imagine, the levels of depression and anxiety have gone to be much higher in children and teenagers. The levels for depression went up 50 to 60%, and the level of anxiety went up 30 to 35%. So, I mean, these are alarming statistics. And, to get to your question, what can we do? And I think that, on the one hand, there's parenting. So, what's your parenting style? And is the family dynamic contributing to mental health conditions? But on the other hand, let's think about all of the contributors. So you have academic pressures, you have social media and the standards that are set on social media. You have a lack of interactions with your peers, right? Because more people are spending time on their devices and less time with people. You might have economic or financial challenges that might be trickling down to a teenager or even a child. And you think about what the pandemic did to to these kids. I mean, all those factors are contributing. And as a pediatrician, I have to ask, how do we set up families to address all of those contributors? right? So on the one hand, as a parent, if you're being a little too overbearing, if you are adding pressure to that teenager, how do we actually scale that back? How do we give that teen some space? And, with that space, making sure that that teen still feels supported. So it's a delicate balance. But then also, how do we create academic environments where we still celebrate success, but we don't create excessive pressure? And then, probably most importantly, how do we encourage teens to connect with one another? How do we create spaces where teens can play and grow and interact and do this without devices and develop these relationships and connections? I mean, that to me is the key, and it feels like that element is lost. I mean, how many people tell you, since the pandemic, I feel lonely, I don't go out as much, I don't I don't even know what my hobbies are anymore. How many people have told you that? I mean, it affected me too. I see it affected all of us, right? So huge, huge issue. And hopefully people are catching on that we need to change our environments and how we interact with these teens.
For sure, for sure. A couple of things with that. So the that Harvard happiness study that they did over where they've studied these people over a very long over a lifespan. And really what they realized is that one of the most important things for long-term happiness is connection and community, being around humans. And I think that that is something that became even more apparent after the pandemic or during the pandemic because we learned that technology alone will never be able to replace human connection. Never. And that's something that's going to be innately in us as long as we exist on this earth. And I think that that's going to become more challenging and challenging as we have the introduction of AI into our life, and it's going to be more intertwined with us. And it's like, how do we not lose ourselves with that? But at the same time, how do we adopt it and understand it's gonna be part of life, but without it's gonna be part of our life, but also knowing that we need to stay connected with our community.
Huge, huge issue. And I mean, that study is likely going to hold up over time. One of those timeless studies where connection with humans is the key to happiness. It is a form of medicine. It's probably the strongest medicine there is, connecting with each other. And how do we encourage people to take that medicine, right? So I would argue that this is not just an individual level problem, though. I think that this is something that needs to be escalated to our local, state, national governments, our global politics. We need to emphasize this because otherwise it's just going to get worse and worse. So I think you hit the nail on the head.
For sure, for sure. We gotta get them outside. We gotta get them moving. And,
Yeah.
that's this is another good leeway to there's so many things I wanna talk to you about. And I guess before I even move on, the fact that this is why I enjoy doing something like this is having a conversation with someone like you that's so knowledgeable on it. And yeah, we're not like in the same room, but we're absolutely connecting with each other, and we get to pick each other's mind. And like, this is what it's all about to kind of tackle these tough questions. Then hopefully someone listens to, portions of this and they're like, oh, you know what? This makes a lot of sense. I probably should change the way that I'm doing things. And I think it's so cool.
And I want to highlight a specific example of this. So when I was a resident doctor in Philadelphia, we had a little courtyard that was adjacent to one of the inpatient wards where there were longer admissions for patients. And the idea was that this garden was healing and it got patients to go outside and connect with nature, but also with one another. And I'll never forget, there was a early teenager, who was unfortunately part of the foster system. And he was in this inpatient ward for a really long time. And it was because we couldn't find a good placement for this child because he had a more chronic medical condition that was generally above the level that foster families can handle. And I had talked to him for a little bit, and he told me that he liked playing basketball. So one day when I was done with my patients, there was actually a basketball hoop in the garden. So we got a basketball, we went out there and we played. And, you know, in my mind, I thought, I'm doing something for this patient. And in the middle of the game, I realized that I was getting just as much out of this experience as he was. I was having a good time. I was disconnected from the screens. I was connecting with this teenager. And how cool is that? How cool is it that, something like basketball or a shared activity can connect you no matter, I mean, I would even argue intergenerationally, right? So, how do we encourage these opportunities for connection? And we need to, I think sports is a good one, but having conversations, meaningful conversations like this one is so important. Creating spaces where people can share ideas in a respectful but also kind of open-minded way. I mean, we need this as a society, right? So I'm thankful for you for creating this platform and this opportunity. So thank you.
Oh, that is a first off, it's my pleasure, and what that is a beautiful story. It really is. I think that I was actually just in this kind of mastermind group where we were talking about our why, and a lot of people were talking about my why is to be able to help people live a longer, a better life. And we kind of as a group dove a little bit deeper into that and being like, "But why are you doing that? Why do you wanna
Yeah,
help these other people?" Right? And
for
when it
sure.
comes down to it, is it because it's actually for us. It makes us feel good. It makes us feel good to help them out. And it's yes, we frame it as we're doing something for them, but we need to accept that we're doing it because it feels good for us, and there's nothing selfish about that at all, right? It's okay to have those conversations. It's okay to be willing to help in order to make yourself feel good because what a positive outlet is that? And so I think it's amazing. Um, I there's so many topics I want to touch on here. I also want to be mindful of your time here. So I'm just looking through my list and I'm thinking, what are the last things that I want to kind of touch on here? Um, Let's do this. This one kind of sounds fun. Are there any parenting trends that drive you crazy that's really not backed by science?
Well, there are a lot of parenting trends that come and go, and parents now might even remember when their kids were on the younger side, some trends that have fallen out of favor. But I did want to call out a few that I see on a regular basis. So one is parents specifically in the United States who are concerned that their child is too picky and must have a vitamin or mineral deficiency, and therefore they are on a multivitamin. And there is no evidence that if your child is growing and developing appropriately, and there's no specific concern for a vitamin or mineral deficiency, that they don't need a multivitamin. So I think that probably there is some misinformation out there, or maybe there's some stress about other parents who might have putting their child on a multivitamin. And so parents are like, well, I heard from this parent that there's this multivitamin that works pretty well. And I would just encourage parents, excuse that, I'd encourage parents to continue to try to just offer all the different food groups, and eventually your kid will be more willing to try things, and multivitamins are not.
What about, I was just reading something. What about roughhousing? Is roughhousing with your kid a good thing to do?
Well, I think that there's certainly benefit to competition, right? There's benefit to creating some form of adversity for your child. And I think that that can take many forms, right? So you can have your child play on a sports team. You can have your child compete with their friends in the backyard. You can have your child be in theater, right? So opportunities for adversity really breed resilience, which I think is hugely important for kids, right? You need to have challenges. You need to feel like you can overcome challenges. Now, roughhousing, I think, can be fun if done appropriately, right? You can have parents who roughhouse, and you can keep it appropriate, but there are times where if it goes too far and kids are getting hurt, then it is clearly more detrimental than it is beneficial. So you got to kind of weigh those risks and those benefits. But I would say that probably ultimately it's not harmful unless you make it harmful, right? But that's true of anything, you know?
Sure. Sure. Yeah. I think, I like giving them the freedom to fail is such a powerful thing where they feel like, "Oh, it's okay to go try this, and if I fail it, it's not gonna be the end of the world." Because what they're gonna learn through that failure and then the recovery process is some of the most important building blocks of someone being. And so I hear
Yeah.
you in a controlled setting. It's just a tough thing to do. I imagine. I can't say this. I'm not a parent, but what I've seen is that there's these overprotective parents that want to prevent seeing their kid in that situation, and so they'll do whatever they can to keep them comfortable and happy, which I think could actually do some more harm than good.
Yeah. I mean, so it's interesting. There was an article published in 2022 in the Frontiers of Psychology, and it was titled "A Systemic Review of Helicopter Parenting and Its
Okay.
Effects on Anxiety and Depression." And the authors highlighted a number of studies, and essentially what they found was that overprotective parenting did correlate with increased anxiety and depression. It's hard to pinpoint in these types of studies what was the chicken or the egg. Was it the overprotective parenting that then led to the anxiety and depression? Or was it that kids who were anxious or depressed, the parents parented a certain way to try to protect them? But to kind of highlight your point, it seems intuitive that if you prevent your child from having adversity, that there's certainly that risk of taking away their autonomy and preventing them from developing resilience. And this kind of goes into the concept of the growth mindset. And we need to encourage kids to fail, to grow. We need to encourage kids to take risks so that they learn. And so, it does seem like we need to keep parents fluid when it comes to their parenting style and make sure that they're not being too protective, like you
Mm,
said.
for sure. Some really good takeaways from this conversation is get your kids outdoors, let them mess up. It's going to be okay. It's part of the learning process, and it's connect and ultimately make them healthier in the long run. But I want to end on kind of tell me where let's end on a positive note. How has medicine evolved to the point today, especially in pediatrics, to where we were in the past to where we are now? And like, what excites you the most?
So it seems like, well, it depends on kind of where you want to start. But I think that what's really interesting is when I talk to some of my mentors who are now in the later stages of their career and talk to them about how the primary conditions that affected kids when they were in their stage of their career, that where I am, were that there were infectious diseases that were harming kids on a daily basis. And we're so fortunate now that infectious diseases very rarely cause debilitating conditions or death. I mean, it does happen, don't get me wrong. And, you can look at the statistics. There's already been, you know, several children who have died from the flu this year, and we still need to work on ways to prevent those deaths in the future. But this is still a huge reduction from those early days of medicine. And, on the one hand, there's the improvement in hygiene, right? We wash our hands now, we make sure food is clean, we have antibiotics. I think that it's important to acknowledge that we have vaccines that can also reduce these risks. It's not all one solution, but all of these things together have really reduced the risk that kids are being debilitated or dying from infection. So now, how do we optimize health in kids and really into adulthood, right? And so some of these things that are coming up that are concerning to families are, how do we address things like autism? How do we address things like we talked about earlier, like ADHD? How do we address things like obesity and mental health challenges? How do we address things like food allergies, which are on the rise? And this is, I think, our next stage of medicine is, how do we address these conditions that are partly because kids are not dying from infections now, So it's an interesting time to be a pediatrician. It's an interesting time to be in medicine, and I'm going to spend my career trying to help these patients and these families. And I hope that when we have this same conversation in 30 or 40 years, that we've made a dent in those conditions.
Oh my God, you're incredible. And what was that? What is that stat that you were sharing with me the other day about like 200 years ago and the survival rate? Do you remember that?
Yeah. So yes. So I believe that it was that about 200 years ago, it was that only 50% of kids made it to their fifth birthday. So, we've come such a long way in reducing the risk of death in early childhood. And now it's down, I believe, to like 1% or less in the United States. And that's huge.
That's so huge. That's so huge and really eye opening for sure. Well,
Yeah, for sure.
Dr. Yoshi, I so appreciate you, man. Like your heart is just a heart of gold. You can tell that you genuinely want the best for your patients and then for our healthcare system. And I can only thank you for being a leader in that and continuing to share the information because if you're someone that's listening to this, he is putting out so much great educational content for parents that and even other clinicians that they can learn from. And so like Dr. Yoshi, if someone does want to maybe kind of see what that information is or learn more about you, where could they find about more information about you?
Yeah. So I my platform is at Dr. underscore Yoshi. I'm on TikTok, I'm on Instagram and YouTube. But then I'm also hoping that in the not so distant future, some of my academic endeavors at my university can start to kind of transition into this educational platform. And I'm excited that I'll be able to share some of that soon. So.
That's amazing. That's amazing. Well, Dr. Yoshi, thank you for your time. I appreciate it, man.
Thank you, Dr. Spencer. This has been awesome, and I appreciate that you've created this platform. And I can't wait to hear from your other guests.
Thanks, man.
You've been listening to the MedStory podcast, where we dive deep into the stories that shape medicine and healthcare. If you found this episode insightful, be sure to follow, rate, and review. Your support helps us bring more valuable conversations to the forefront. This has been a MedStory Studios production, where storytelling meets medicine. Until next time, stay informed, stay inspired, and keep pushing the boundaries of what's possible in healthcare.